An important question can anyone asks, does the natural course of sexual activity affect after penile implant placement? The answer is no. The goal of a penile implant is to achieve rigidity for as long as possible to complete sexual intercourse. When properly placed inside the penis, it does not affect the nerves or blood vessels of the penis. As a result, the process is completely natural. The sensation is natural, the pleasure is present, the ejaculation is natural, and the procreation is natural. After the operation and implant placement, the patient is followed up for 2 weeks after discharge from the hospital. This is to ensure that the implant is in the correct position, that no infection has occurred, and that no complications have occurred after the operation. The results of the implant operation are impressive, to the extent that a study in 1997 showed that 89% of wives whose husbands had implants felt complete satisfaction with their marital relationship after the operation. Another study in 2008 showed that the satisfaction rate increased to 97%. This tells us that the implant operation is a radical, simple, and final solution to sexual dysfunction problems in which the patient has lost response to medical treatment. But we still repeat and insist that the implant is the last solution we resort to after exhausting all treatment methods. But there is no doubt that it is an ideal solution, a simple solution, easy solution that solves the problem for life, achieves complete happiness for couples without any complications, because it is a local thing and does not affect all body functions. Unlike medical treatment, the implant will remain the ideal solution for the patient with erectile dysfunction that does not respond to medical treatment. Thank you.